Have you ever wondered if more medical tests really lead to better health? The truth may surprise you. After age 60, our bodies start to change in ways that affect how we respond to health checkups. Although regular screenings are important, as we get older, the balance between the benefits and the risks of these tests shifts. In fact, not every test recommended for younger adults is as valuable for seniors. Many seniors fall into the trap of undergoing frequent checkups without considering their unique health status, lifestyle, or family history. The National Institutes of Health, NIH, and the Centers for Disease Control and Prevention, CDC, both stress that overtesting can lead to overdiagnosis and overtreatment, especially in older adults. Overdiagnosis occurs when a test finds a condition that would never have caused symptoms or affected your quality of life. When this happens, it can result in unnecessary procedures, medication changes, and emotional stress. Imagine a fire alarm going off in a building just because of a little dust. Even though there's no real danger, the alarm triggers panic and a costly evacuation. This is exactly what happens when seniors undergo frequent screenings for conditions that would not have affected their health in the first place. Many people make the mistake of scheduling every available test, thinking it will keep them healthier. But in some cases, tests designed to detect early-stage conditions in high-risk populations may not benefit someone who already leads a healthy lifestyle. For example, someone who exercises regularly, eats a balanced diet, manages stress, and gets enough sleep might not need certain annual screenings. A study by Harvard Health supports this approach, suggesting that screenings should be based on individual risk rather than a one-size-fits-all mentality. The key to aging well isn't just about having regular medical tests. Lifestyle factors like daily physical activity, eating nutrient-rich meals, and managing stress have a far greater impact on long-term health than the frequency of specific tests. In fact, regular activities like walking for 30 minutes a day, eating plenty of vegetables, practicing mindfulness, and avoiding prolonged sitting can help prevent cardiovascular disease, type 2 diabetes, and cognitive decline. These habits do more for your overall health than any test can. Tests alone can't capture the positive effects of regular exercise, good nutrition, and proper rest. There's also a psychological aspect to overtesting that many people overlook. Constant checkups can lead to medicalization stress, a form of anxiety where the anticipation of test results creates tension, disrupted sleep, and even high blood pressure. The Cleveland Clinic has highlighted how stress can make existing age-related conditions worse, meaning that the act of overtesting can sometimes do more harm than good. Seniors often forget that their bodies have built-in resilience from years of maintaining healthy habits. In many cases, practices like controlled breathing, journaling, and yoga can do more to improve health than undergoing additional tests. Moreover, focusing on minor abnormalities discovered during routine tests can be misleading. Many seniors receive diagnoses based on incidental findings that never develop into serious health problems. The NHS points out that unnecessary procedures following these findings can result in complications, including infections, medication side effects, and surgery risks that might have been avoided. It's essential to understand that functional health, how well the body works day to day, is often a better indicator of overall health than any single test result. Tracking energy levels, mobility, balance, cognitive sharpness, and digestion provides a clearer picture of well-being than relying solely on tests. Now, let's take a closer look at some of the most common tests that seniors overdo and why they might not always be necessary. One test that many seniors are drawn to is the full body scan. It seems like an appealing option for early disease detection, but after 60, these scans can actually do more harm than good. Full body imaging techniques like CT scans, MRIs, and PET scans can detect early signs of health issues. However, repeated exposure to these tests, especially radiation-based ones, can increase the risk of complications over time. According to the National Institutes of Health, NIH, and the American College of Radiology, unnecessary imaging can add to the cumulative radiation dose, which might cause future problems, particularly in seniors whose bodies are already undergoing age-related changes. Many seniors make the mistake of scheduling full-body scans regularly, believing that more testing means better health. Unfortunately, these scans often detect small, insignificant anomalies that are unlikely to ever cause harm. The result? More tests, biopsies, and procedures that can cause stress, physical discomfort, and unnecessary medical expenses. Think of it like this. A well-tuned car doesn't need its engine taken apart for inspection every few months. Similarly, a doctor can monitor key health indicators like blood pressure, cholesterol, and lifestyle habits without subjecting the body to these unnecessary scans. In fact, Harvard Health recommends a risk-based approach, emphasizing that age, personal history, and lifestyle factors should guide the use of imaging tests rather than relying on blanket screening. A big part of this issue is the psychological toll that frequent scans can have. Many seniors experience something called scanxiety, a form of stress where the anticipation of results causes anxiety, sleep problems, and even elevated blood pressure. The NHS has pointed out that the emotional strain from these tests can sometimes outweigh any potential health benefits. The cycle of follow-up tests, triggered by incidental findings, small abnormalities that don't progress to illness, can leave seniors feeling anxious and burdened. Instead of relying on full-body scans, it may be more beneficial for seniors to focus on functional health. This means monitoring how well their body performs in everyday activities, like walking, carrying groceries, or climbing stairs, rather than obsessing over individual test results. Seniors should remember that a healthy lifestyle can go a long way in preventing many of the diseases that these tests aim to detect. Regular physical activity, a nutritious diet, good sleep hygiene, and stress management can make a bigger difference than any diagnostic test. So, while medical scans may offer reassurance, it's the everyday habits that provide the most long-term health benefits. One area where seniors often overtest is heart health. Many seniors believe that the more heart screenings they have, the more protected they'll be. But after age 60, that's not always the case. Tests like stress tests, coronary calcium scans, or advanced imaging techniques can reveal issues that may never develop into serious health problems. The heart is remarkably resilient, and many minor abnormalities found in these tests do not necessarily mean the person will develop heart disease. In fact, the National Institutes of Health, NIH, and Harvard Health emphasize that routine heart imaging without specific symptoms or high-risk factors may provide little benefit while increasing anxiety and potential health complications. A common mistake seniors make is relying on technology and medical tests to replace healthy lifestyle choices. For instance, someone might have an annual coronary CT scan to check for heart issues while continuing to lead a sedentary lifestyle, eating a high-sodium diet, and experiencing poor sleep. The test might show calcium deposits or minor blockages, but it doesn't address the root causes of heart disease, such as poor diet or lack of exercise. The Cleveland Clinic has stated that lifestyle changes like regular aerobic exercise, stress management, and maintaining a healthy weight are far more effective at preventing heart disease than frequent heart scans. In fact, simple activities like walking, swimming, or even low-impact exercises like Tai Chi can improve circulation, lower blood pressure, and maintain healthy blood vessels. A heart-healthy diet rich in fruits, vegetables, whole grains, and lean proteins reduces inflammation and oxidative stress, which are key contributors to cardiovascular disease. These lifestyle choices can improve heart health at a cellular level in ways that imaging simply can't replicate. So, instead of obsessing over heart scans, seniors should focus on making sustainable, healthy choices that promote heart health on a daily basis. Additionally, stress management plays a crucial role in maintaining heart health, but it's often overlooked. Chronic stress can raise cortisol levels, increase blood pressure, and worsen heart conditions. Seniors who focus on reducing stress through practices like meditation, deep breathing, or spending time with loved ones can lower their cardiovascular risk. The Mayo Clinic suggests that consistently managing stress has measurable benefits for heart health, including better blood pressure regulation and heart rhythm stability. On the other hand, frequent heart tests can trigger medical stress, which can exacerbate the issues these tests aim to identify. Ultimately, while heart screenings can be helpful, they are not a substitute for a heart-healthy lifestyle. Functional assessments, like monitoring blood pressure, cholesterol, and heart rate, along with observing how well the body performs during everyday activities, provide more actionable insights into heart health. Harvard Health advises that seniors prioritize these lifestyle changes over frequent heart imaging to maintain optimal heart health and overall well-being. Another common mistake seniors make is overtesting for cancers. Prostate and breast cancer screenings are often considered standard preventive measures for older adults, but after the age of 60, routine screenings for these conditions can be more complicated than many realize. Annual mammograms and prostate exams have long been promoted as essential tools to catch cancer early. However, as people age, the risk of overdiagnosis increases significantly. Overdiagnosis occurs when tests detect slow-growing or non-threatening conditions that wouldn't have affected the person's health if left undetected. The problem is, once these conditions are identified, they often lead to unnecessary treatments, anxiety, and a disruption of daily life. The National Health Service, NHS, and Harvard Health both emphasize the importance of individualizing screening decisions, especially for seniors. Rather than adhering to a rigid annual testing schedule, seniors should take into account their overall health, life expectancy, and specific risk factors. Many older adults fall into the trap of assuming that routine screenings will always be beneficial without considering the potential drawbacks or how their lifestyle choices could be more effective preventive measures. The emotional toll of frequent screenings is also often underestimated. The process of waiting for test results or coping with abnormal findings, especially when they're minor and unlikely to develop into significant health issues, can lead to stress, anxiety, and sleep disturbances. This cycle of worry, often referred to as scanxiety, can have physical effects, including elevated blood pressure and higher cortisol levels, which may exacerbate existing health conditions. The Mayo Clinic's research has shown that the emotional toll of overtesting can sometimes be just as detrimental as the health risks the tests aim to prevent. Instead of focusing solely on routine exams, seniors should consider focusing on lifestyle habits that support overall health. Eating a balanced diet rich in leafy greens, whole grains, and lean proteins can help maintain hormonal balance and prevent disease. Regular physical activity like walking, stretching, or light resistance exercises also contributes to maintaining strength, mobility, and heart health. So, while screenings like mammograms and prostate exams are important, they may not always be necessary for every senior. A more thoughtful, individualized approach to health screenings is crucial for avoiding unnecessary interventions that don't improve long-term outcomes. Instead of relying on a cycle of routine tests, seniors can prioritize functional health, focusing on how well their body performs in daily activities and maintaining healthy habits. As we explore the impact of overtesting, it's essential to look at other common screenings that many seniors undergo, like colonoscopies. Colonoscopies are widely promoted as an essential preventive tool for colorectal cancer detection, typically scheduled for adults over 50. However, for many seniors, repeated colonoscopies may not be necessary. After age 60, the digestive system naturally changes. Seniors may experience slower bowel motility, changes in the microbiome, and increased sensitivity to procedures like bowel preparation and anesthesia. Unfortunately, many seniors schedule colonoscopies out of habit without considering their individual health status, family history, or risk factors. The NIH and the American Cancer Society both stress that while colonoscopies are important for detecting colorectal cancer and precancerous polyps in high-risk individuals, the risk-to-benefit ratio changes as people age. For older adults, the physical and psychological stress of the procedure, including bowel preparation, sedation, and recovery, can outweigh the marginal benefits of routine screenings in low-risk populations. The Mayo Clinic has noted that while colonoscopies are generally safe, they are invasive and can carry risks, particularly for older adults with coexisting health conditions such as heart disease, diabetes, or reduced kidney function. Another issue is overdiagnosis. Colonoscopies often detect incidental polyps or benign anomalies that may never develop into serious disease. Once these are identified, they frequently lead to unnecessary interventions such as biopsies, surgeries, or further testing that carry their own risks. The emotional burden of these procedures also cannot be ignored. The anticipation of results, potential follow-up procedures, and the invasive nature of the preparation process can cause anxiety, sleep disturbances, and increased stress, which may worsen pre-existing conditions. This is an example of how unnecessary testing can do more harm than good. Instead of relying on frequent colonoscopies, seniors can focus on preventative measures that are less invasive and more sustainable. A fiber-rich diet, including fruits, vegetables, legumes, and whole grains, naturally supports gut motility and helps maintain a healthy microbiome. Adequate hydration and regular physical activity, such as walking, yoga, or light resistance exercises, also support digestive health and regular bowel function. Harvard Health emphasizes that these lifestyle habits can significantly reduce colorectal cancer risk, even more so than frequent colonoscopies. Furthermore, for seniors without symptoms or a history of polyps, non-invasive screening methods like fecal immunochemical tests, FIT, or stool DNA testing can provide meaningful insights while minimizing the physical strain of invasive procedures. The CDC suggests that these tests can offer a practical, less disruptive alternative for monitoring colon health, allowing seniors to avoid unnecessary procedures while still staying proactive about their health. By focusing on nutrition, exercise, and stress management, seniors can protect their digestive health in a way that is sustainable, cost-effective, and less stressful than relying on routine colonoscopies. This lifestyle-based approach not only improves gut health but also promotes overall well-being, reducing the need for frequent, invasive screenings. As we conclude this discussion, let's take a moment to reflect on the overall principle that more isn't always better when it comes to health screenings, especially as we age. Seniors often make the mistake of assuming that frequent tests and checkups are the best way to maintain health. However, a constant cycle of medical screenings can lead to unnecessary interventions, emotional stress, and even physical harm without necessarily improving long-term health outcomes. The key to aging well lies in balancing medical advice with healthy daily habits and focusing on what truly matters: functional health. Instead of relying on a constant stream of tests, seniors should prioritize personalized, risk-based screenings that are tailored to their individual health profiles. Trusted sources like the Mayo Clinic, CDC, NIH, and Harvard Health all emphasize that a more thoughtful, individualized approach to healthcare is far more effective than following a rigid testing schedule. For example, seniors who lead an active lifestyle, eat a nutrient-dense diet, manage stress effectively, and get enough sleep may not need frequent full-body scans, stress tests, or colonoscopies. In fact, these tests can often cause more harm than good by detecting minor issues that would never have progressed to serious health problems. One of the most important takeaways from this conversation is the critical role of lifestyle in preventing disease. Simple, daily habits, such as regular physical activity, a balanced diet, good sleep hygiene, and stress management can have a far greater impact on health than any single diagnostic test. For example, exercise improves cardiovascular health, boosts metabolism, supports joint flexibility, and enhances cognitive function. Eating a diet rich in fruits, vegetables, whole grains, and lean proteins supports immune function, maintains healthy weight, and stabilizes energy levels. Stress reduction techniques like mindfulness, journaling, and social interaction can help lower inflammation, reduce anxiety, and support mental well-being. These lifestyle interventions create a foundation of resilience that can help seniors stay healthy without constantly relying on medical tests. They also help minimize the physical and emotional toll that comes with over-testing. Furthermore, maintaining good habits that promote heart health, digestive wellness, and mental clarity can be more empowering than awaiting test results. By focusing on what you can control your daily habits, you can improve your health and quality of life while reducing unnecessary stress and reliance on medical technology. In the end, it's important to remember that healthcare is not just about tests and procedures. It's about understanding your body, listening to your needs, and making informed decisions that align with your personal health goals. The next time you're considering a test or screening, ask yourself, is this really necessary for my well-being? Or is there a better way to maintain my health? The answer often lies in the choices you make every day: how you eat, move, sleep, and manage stress. By integrating these simple but powerful practices into your routine, you can improve your health more sustainably than any medical test could. So, the message is clear. More tests do not necessarily lead to better health. Instead, focus on smart, individualized screenings and make lifestyle changes that support your body's natural resilience. By doing so, you'll be able to age gracefully, maintain your independence, and enjoy a higher quality of life. If you're ready to make this shift toward a more balanced and proactive approach to your health, start today. Listen to your body, make thoughtful decisions, and remember that the best way to stay healthy is to support your body with habits that promote long-term wellness.